Hi, I'm Emma from Petplan. I'm here today with Brian Faulkner. Brian, today we're talking about diabetes in dogs. Can you tell us a little bit about diabetes?
Well, diabetes, or sugar diabetes as we call it, is when the sugar levels within the blood get out of control because the body's insulin doesn't work or it's either underproduced. So it's all about regulation of sugar in the body.
What are the common symptoms that we could see in a dog that may have diabetes?
In dogs there's a range of symptoms. Probably the one the owners may notice first of all is drinking a lot of water. There's other causes of course, but that's a very common one. So drinking out of puddles, drinking out of ponds, drinking out of the toilet even. But that's the one people notice. Sometimes wetting more, sometimes even breaking their house training. They may wet in the house when normally they haven't done before. They may notice weight gain, they may notice lethargy, and eating. Appetite often goes up in diabetes. So a range of symptoms, but usually around thirst.
If we suspect that these symptoms are happening in our dog, what would the treatment options be that you would suggest?
Well, first of all, we diagnose it. For example, look at Daisy here. She came in a couple of years ago with all these symptoms, and we took a simple blood sample after a urine sample, and we confirmed that she had indeed an increased blood glucose level. So we decided that she needed treating for diabetes. And the diabetes treatment revolves around insulin injections. There's no other way, unfortunately, in dogs of doing it, and that will mean insulin injection every day, sometimes twice a day. So it's quite simple, and I can demonstrate to you. We've got an insulin injection here, and you'll notice that you won't even feel it. So we just give it into the scruff, and we teach owners how to do this. It's quite simple. There we go, injection. Look, she never even flinched. Good girl. So that's what we teach our owners to do. We also teach them how that works in relation to feeding and certain diets, and also with a view to exercise and weight control. So it's a combination of management. So we're going to take a blood sample here from Daisy to monitor her diabetes. She's due a monitoring check. So one of the easiest places to take a blood sample is actually from the jugular vein. It's a large, easily found vein. So we just in with the needle. There's a good girl. And we just draw out. That's all we need. Good girl, Daisy. We pop it into the little tube, which we'll analyse later.
Brian, can you tell us this treatment for diabetes, how successful is it?
Well, unfortunately we can't cure diabetes, so it is management for life, and that's really important. Owners must understand that from the beginning, and we really try and set that expectation. So it can be expensive because of all the insulin and the injections and the needles and the food, so people have to be prepared for that. But if we treat, it really can be very successful. The dogs lead normal lives. We have to be careful, of course, with what they eat and when they eat, but in day-to-day life it can be very successful, and dogs can live a normal, enjoyable life.